It is a rare unifying moment. Hospitals, doctors, health insurers and some consumer groups, with few exceptions, are speaking with one voice and urging significant changes to the Republican healthcare legislation that passed the House on Thursday. The bill's impact is wide-ranging, potentially affecting not only the millions who could lose coverage through deep cuts in Medicaid or no longer be able to afford to buy coverage in the state marketplaces. With states allowed to seek waivers from providing certain benefits, employers big and small could scale back what they pay for each year or reimpose lifetime limits on coverage. In particular, small businesses, some of which were strongly opposed to the Affordable Care Act, could be free to drop coverage with no penalty. The prospect of millions of people unable to afford coverage led to an outcry from the healthcare industry as well as consumer groups. They found an uncommon ally in some insurers, who rely heavily on Medicaid and Medicare as mainstays of their business and hope the Senate will be more receptive to their concerns. The American Health Care Act needs important improvements to better protect low- and moderate-income families who rely on Medicaid or buy their own coverage. Marilyn B. Tavenner, the chief executive of America's Health Insurance Plans, the industry's trade group, said in a strongly worded statement. Continue reading the main story. Related coverage. House passes measure to repeal and replace the Affordable Care Act May 4, 2017. Anthem threatens to leave health exchanges if subsidies are halted. April 26, 2017. Patients who rely on Obamacare protections are worried. May 2, 2017. Molina, key provider under Obamacare, ousts CEO, a Trump critic. May 2, 2017. Affordable Care Act, a tale of two states. April 21, 2017. Others were even more direct about the effects the bill would have, not only on patients but also on the industry. To me, this is not a reform, said Michael J. Dowling, the chief executive of Northwell Health, a large health system in New York. This is just a debacle. Hospitals that serve low-income patients will just be drowning completely when this happens, Mr. Dowling said, noting that more people would become uninsured at the same time that government payments to cover their costs were reduced. In contrast to hospital and doctor groups, insurers had largely remained silent about their reservations, perhaps in the hopes of bartering their low profile in exchange for assurances that billions of dollars in subsidies for low-income coverage would continue. The White House and Congress have gone back and forth about their willingness to pay for the subsidies, prompting anxiety among some companies. Several, including Anthem, have threatened to sharply raise their prices or leave markets altogether without the funding. But a few, including Blue Shield of California, came out in opposition to the bill before the vote. We feel compelled to oppose it, said Paul Markovich, the company's chief executive. It raises the specter that the sickest and neediest among us will be disproportionately hit in losing access. After the House passed the bill on Thursday, the industry's two major trade groups urged lawmakers to increase the tax credits available to help people pay for coverage, and to adjust them to assist those who are older, live in high-cost areas or have lower incomes. But the overriding concern, for insurers, many workers and officials throughout the healthcare systems in many states, is the broad reductions proposed for Medicaid, even for insurers that have largely abandoned the individual market. Like United Health Group and Aetna, a substantial portion of their business is providing coverage under Medicaid. The same is true for many local nonprofit plans, said Cissy Connolly, the chief executive of the Alliance of Community Health Plans. Employers and others said they were also concerned about the effects on freelancers, who do not have a traditional employer but are self-employed or contract workers in the so-called gig economy. Depending on their income, those workers have shuttled between Medicaid and the individual insurance market under the federal health care law, which offered a greater level of stability, said Nell Abernathy, vice president for research and policy at the Roosevelt Institute, a left-leaning economic research organization. A huge swath of Americans are in insecure work arrangements, she said. This repeals that level of security, which was not perfect, but it was a step in the right direction.